Thank you. Thank you. Wow, thank you, thank you. Nothing like playing on the home field once in a while. Really great to see you. It feels like a family reunion to come back to Western New York and to see the faces of so many people that have who make this community so outstanding, and a place that I'm always going to be proud of to call my home. And we are joined by some extraordinary leaders, people that I've come to work with for many, many years. And I want to give a special shout out to our Congressman, Brian Higgins. Brian, please stand up. He is a champion for this region like no other, and we are the beneficiaries of his tenacity in ensuring that Western New York gets every dime it deserves and more. So he's a great fighter. Brian Higgins. I feel that you'll be hearing from our great Mayor Byron Brown. I want to recognize him here as well. I'll be introducing him. You'll be hearing from Jeff Peroni, the Executive Director of the National Alliance on Mental Illness, Buffalo and Erie County. Jeff, thank you. Where's Jeff? Jeff, thank you. Kevin Smith, the Director of Mental Health and the Peer Connection. Kevin will tell us his story as well. Kevin, thank you so much for being here today. We have Thomas Buford, the President of the Buffalo Urban League, has joined us. Thank you, Thomas. And Mayor Eddie Sundquist is all the way up from his community. Mayor, thank you for coming up from Jamestown. And Mayor Willie Rosas from Dunkirk, thank you for making the journey upward, because this is a situation we're talking about mental health. It is not an urban issue. It is not a suburban issue. It is not a rural issue. It is a national crisis. And so thank you for representing your region so well as the other elected officials who've joined us, who will be acknowledged briefly shortly. Also from my home team would be Commissioner Tim Hochul. Tim, stand up, please. We pirated him away from Western New York, but he is the New York State Commissioner of Civil Service. And in the past, people would think of the word civil service and go, ugh. And now they say yes. He has liberated the ability for millions of New Yorkers to get access to good-paying jobs by just rethinking our whole approach. And I want to thank him for being that transformative leader at a time we need him most. So Tim Hochul, thank you. Thank you for what you do. Dr. Ann Sullivan, the Commissioner of the Office of Mental Health. Dr. Ann Sullivan, you are incredible. She talks about this issue with such compassion as she travels every corner of the state, and she is a tremendous ally of those who need our services and all the great providers. Let's give a round of applause to Dr. Ann Sullivan. Jahoon Kim has joined us. Well, he's our Deputy Secretary for Mental Health, and he is one of the architects of many of our great policies. I want to give him a shout out as well. Jahoon, where are you? Jahoon. Mayor Supervisor of Amherst has joined us, Brian Culpo. I just thought I saw you in the front row there as well. Also, Candace, where are you, Candace? Candace Muffins. Where are you? Candace, right there, right in the front. I should have noticed you right off the bat. And thank you for allowing us to come to this place. Sometimes the occasions are sad, sometimes they're joyful, and sometimes it's just an opportunity for us to gather. But you have done an incredible job with this facility, Candace. It is a refuge for so many in this neighborhood, a place people gather and know that it's a safe space for them. And I thank you for your friendship over many, many years. Let's give her a round of applause. And it is a gathering place. It was just around this time 1 year ago when we welcomed President Biden and the First Lady, who came here to console our city after the Tops tragedy, the Tops massacre. They came to wrap their arms around us, to give us care and comfort and empathy. And you think about those traits, it's something that we've all tried to give to this community over this last year. It's been so difficult. You know, the trauma was felt by the immediate families, but that trauma had a ripple effect. It just sort of penetrated this community, and it gave us a sense of vulnerability. And what is so sad is that, you know, we sought a shoulder to cry on and many to trust and confide in, but you never know the real scars that are internal, that live with people for a long time. And so people from this event and others have had to seek out services to help them carry that weight so they're not alone. And even those who don't have a direct connection to Buffalo and what happened here, we all need help at different times in our lives. And it's to say that and to acknowledge that is something that people have felt ashamed to talk about. There's always a stigma associated with how you cope with life, whether you can have the resiliency that sometimes the human spirit is called upon to display when sometimes things are so horrific. And I have to think, after the acknowledgement that we just experienced our 200th mass shooting this year, that it reopens the wounds for a community like Buffalo. I mean, the families have to be re-traumatized again because they know that searing emotion that says, why my son, why my daughter, why my father, why my wife, my husband, my grandma, why? And there are no answers. And then you couple that trauma on top of the lingering effects of the pandemic, which 3 years ago, when it was just something we're getting familiar with and thinking it's going to be over by summer in 2020, that still has scars on all of us. And since the pandemic, more than 1 in 3 New Yorkers have sought mental health care. 1 in 3 New Yorkers. Now, to me, that is a positive in that people sought health care. They sought the help, or they know someone who has, but it also means there's probably a lot of other people that are still living with it. And you know what's incredible is our young people are reporting distress unlike anything we've ever seen, unlike anything. And those who had their lives turned upside down when they're just getting used to the environment of a classroom and the security of leaving their home, and sometimes the home life is not a nurturing environment at all. The school is their refuge. They go there, there's teachers, there's administrators, there's people who care about them. There's a connection with others in their situation, other classmates. And to all those whose lives were turned upside down with the experiment of remote learning, God bless our teachers and the parents who had to become teachers at the dining room table for what they went through. But looking back, it was not a bright spot in that time because our kids fell behind and they fell hard. And also, just that disconnection from life's milestones, the missed graduations, the missed junior prom, and all those things that you feel connected to others. And people found comfort in social media in a different world unrelated to physical human connection. So, they say that the Pew study showed that 41% of American adults reported psychological distress in the last couple of years, but the number is almost 60% when it comes to young people between 18 and 29. And this moment is interesting to have this conversation because May is National Mental Health Awareness Month. I think we're all aware of it. I think in past years it was just one of those days once you wear the colors, you pass, move on. I think it has real meaning to us this year. That's what we've been to. It's also the start of the National Children's Mental Health Awareness Week as well. So you look back where we are today, we know what the stressors have been on all of us today, but throughout history, no state has really leaned hard into saying, we're going to help, we're going to find solutions. We are part of the challenge in finding the right answers. And there's been so many barriers. It's hard to get an appointment for those who finally say, I want help, and it's a tough realization to say, I need help, but then it takes a long time to get an appointment. Sometimes insurance wouldn't cover the services, so is this going to be out of pocket? And does that mean you're not going to be able to make ends meet very easily that week when the cost of eggs and diapers and kids' sneakers are off the charts? So you prioritize someone else over yourself, as parents often do. There's long waits in hospital beds, and people fall through the cracks. Sometimes they're visible, sometimes you see them, and we think about the young man, Jordan Neely, who was in New York City in the throes of a crisis, who was tragically killed on the subway this week. His death is clear evidence that we need support. We need alternatives for these individuals so they're not relegated to that kind of life. So those of us in government, it is a wake-up call. It is saying society's frayed right now, our people are hurting, and shame on us if we don't step up and say, no, we're here to help. We can do something. We have the resources. We just have to dedicate them to the services that we know will work over time. And that's exactly what I focused on in this budget. I came out and said, we're going big. This crisis has hit too many New Yorkers. It is too painful. And in my budget that I announced in January, I said, I am putting forth $1 billion to make an historic investment to transform our state's mental health care systems, our whole delivery system, and enhance everything about it. The last time the state government really paid attention to, thank you. The last time people paid much attention to, the state's role in mental health services was the deinstitutionalization that occurred in the 1970s. My family lived in Hamburg, not too far from the West Seneca Developmental Center. My parents were very much social activists. Every cause they were involved in, they brought all of us. And my parents started being involved in a program to help young people who would be unlocked from living in that institution to be out in society. Now, open the doors and all of a sudden, after spending most of your life here, if you're 16 or 18 years old and you're on your own, would be kind of cruel. So they found volunteer families like ours, and we took in 2 young adults, Melanie and Roger. And our job, and I was probably 13 at the time, 14, was to take Melanie when she'd come stay with us, walk to the village of Hamburg, take her to the little 5 and dime, the little Woolworth store, teach her how to buy things, go to the grocery store, the Bell's IGA on the corner. And so we also took Roger, my brothers took him to play sports, and so that's like a microcosm of the way it worked for a little while. I don't think it helped 99% of the people. They were just left out there on the streets. Couple that with many of our veterans who came back with mental health problems from Vietnam because no one acknowledged what they had gone through, including many of my uncles and family members who still feel the effects. We ignored everybody. We just sweep it under the rug and maybe they'll go away. Until now we have a crisis. So I've been governor a year and a half. My first budget as an elected governor, I said, this changes. This changes right here and right now. And so I needed to hear from our leaders. What is the answer? I didn't know the answers, but I'm smart enough to know who to ask. And we pulled together a team, and in government, outside government, the providers, tell us, all of you who've lived the experience of helping people, what it's going to take. And we have to focus on the whole continuum of care. What does that mean, continuum of care? It means everything. It means preventative, and I'll be doing some forums with young people, as I started already, to meet with them and talk about how we can invest in supporting young people in school so their problems today don't become crises as adults. So it's that early intervention in our youth. Also, hit people at different stages, a lifeline for people. And it's also saying if someone needs to be in a hospital for mental health services and they're discharged, we're not done with them. We have to say, before you go, here's the next step. Here's the counselor, here's the therapist, here's where you show up, here's the supportive services, here is the facility where you can go sleep tonight, so you're not left on the streets. Our city is a shining example of how to do this right. Out of 13 certified behavioral health clinics across the state, 3 of them are here right in our city. 3 out of 13 across the state. Best Self, Endeavor, Spectrum, I want to applaud them. Please stand up because they're doing God's work. They're doing God's work here now. Thank you. Thank you. Best Self, Endeavor, Spectrum, thank you. Thank you. These are places that offer 24 hours a day mental health services, substance abuse services as well, and there's a lot of overlap. A lot of people find comfort and escape in substance abuse because of mental health challenges. There's that sense of longing, there's a sense of need, there's a sense of loneliness, and just, reading the paper today, and I still read a piece of paper instead of online every time. The Surgeon General is now giving advice on how to feel less lonely. Now, usually the Surgeon General is saying, don't smoke, get vaccinated, get your flu shots, and now they're trying to tell us, because this clearly is symbolic of the fact that this is a national crisis. So the good news is there are organizations who walk through these doors, people who walk through these doors, these organizations, regardless of your age, regardless of insurance status, you can get a whole comprehensive array of services. And these clinics are game changers, but guess what? 3 is not enough in Buffalo, 13 is not enough statewide, and we're going to be tripling the number from 13 to 39 this year already, so we're going to increase the number. We expect to we'll have to help several 100,000 more people with this expansion alone. And also people without insurance. As I mentioned, the cost of everything. My budget that was just enacted prohibits insurance companies from denying access to critical mental health and substance abuse disorder services. Now the insurance companies have to cover it. That is going to be a big step toward making sure that everyone has access to quality health care. We're also adding psychiatric beds. What happened during the pandemic? A lot of beds had to be transitioned into COVID beds, but we haven't needed that for a while. And there was a disparity in reimbursements also. Mental health services are very expensive. 1 bed requires psychiatric nurses. You need to have a doctor with psychiatric background. So the costs are extraordinary. And so we're working with the hospitals to get more beds back online, but understanding there's more costs involved with that. You made all these changes to turn them into COVID beds, flipping them back, there's more security required. I'm seeing Tom Catroci here from ECMC. Thank you, Tom. Tom has told me firsthand, their desire to bring more beds online, but it's a lot of money. It's a lot of money for hospitals that are still hurting from revenue loss from the pandemic. I understand that. Tom calls me all the time about it. So more beds online, that's just a start. And also, we're going to continue serving people any way we can. Outpatient services, the reintegration, as I mentioned, freeing up needed space for inpatient care. But also there's one element that you heard me talk about in my budget, and that is housing. The whole continuum of care requires people to ultimately not be living in a hospital bed, not living on the streets, but in a home that is safe, has supportive services, wrap around, and we will take care of you like a big hug. And that's what wraparound means to me. And so we're going to be building more of that housing. We're investing in 3,500 more housing units that will provide these intensive mental health services to help someday liberate people from the demons that have taken over their lives so they can walk out someday and say, I'm free. I'm free. I'm going to be okay. I can provide for myself. I can someday take care of a family. And also, as we mentioned, substance abuse disorder, opioid addiction. My gosh, seems like, I remember not long ago just opening the newspaper and seeing all the obituaries. And the faces were so young. They used to be old people, old like me now. I used to read the paper, and then now you see all these beautiful young people. Opioid deaths have increased more than 50% from 2018 to 2021. We were making progress. We had turned the corner somewhat. I've been tracking this since my days on the town board with Tom. We started seeing the numbers go up. The police would tell us there's kids overdosing from heroin. What do you mean, heroin in Hamburg? Yeah, it was happening 12, 15 years ago. We started turning the corner, and then COVID just hit like this. And all the support system, going to a therapist and not having the beds available, it all collapsed again. And that's what we're trying to get out from under. And the use of fentanyl, which is so deadly, and other derivatives from that. So many families, including my own, lost a loved one. And this just has to stop. So we can't once again say, well, we can't do anything about it, it's just too much. The scale is too big, it's too widespread. We don't give up. We lean harder into the problem. We say there has to be an alternative for these people that are so lonely, so depressed, so stressed out with life that they turn to this. We have to give them better alternatives. And that is something I'm going to be committed to with every waking moment I am your governor, because I believe we can do so much more. We have to expand our life-saving tools, naloxone, fentanyl test strips, and drug testing technology. And lastly, I'll talk about our kids, as I mentioned a little bit. I did convene a group of teenagers ages 14 to 18 in the Bronx recently. Kids came from all over. They had fascinating stories to tell. I just said, what was it like to live during the pandemic? They all had stories to tell. And this group of individuals said that there was nobody for teenagers to talk to. Nobody understood what we were going through. We kind of went through this alone, and a couple of young women, I was so impressed, said, I kind of became the therapist. They all come to me. Remember, Dr. Sullivan, they were talking about this. And she said, even my father, who was depressed, he would talk to me at the end of the day, and my friends would call me. She goes, I said, who did you talk to, sweetheart? I said, I didn't have anybody. I was just absorbing all this. I'm in awe of these kids. But these kids said to me, I said, what should we do? They said we should need more peer counseling. They don't want to talk to adults sometimes. Train us, tell us what we need to know. Let us be that ambassador. Let us tell them they're going to be okay. Let us be that beacon of hope for these other young people in our classrooms. And I was so optimistic when I left that. We're just getting started. We're going to continue convening these groups all over the state, but their isolation from the pandemic, what's going on in their neighborhoods, and neighborhoods are tough. There's some really tough neighborhoods. Nobody wants their kids to have to endure that. I'm the first mom to become a governor in the state of New York, and it is some connection that I can't overlook. And I look at little kids as all part of my own family, and we have to help them. They need our help. And the statistics are staggering, and these teenage girls are 30% of them considering suicide. I mean, teenage girls supposed to have a more carefree life, perhaps, get excited about the next chapter, and they're feeling the weight of such depression that they'd rather consider the alternative to life. That's almost up 60% from a decade ago. So they're falling fast, and they're falling hard. And it's a full-blown crisis. This is more than a call to action. It is a moral imperative to do something to help our people. These are God's children. So we have to connect the kids to school-based services and continue making these investments in guidance counselors and therapists and social workers in so many schools. I'm describing the job of the teachers. They're expected to do all this. It is too much. We are putting a record amount of money, $34.5 billion in education this year, and I'm saying to all of our schools, you've never seen this kind of money before, but I know you're under stress, but you need to use that to bring in mental health counselors into the schools. Every school needs somebody, and not just one person for 700, which is what these children in the Bronx told me. Well, we have a therapist, we have 700 kids in our school, and you can't get an appointment for months. That's not satisfactory. We need to just embed this into our education system. It's right there on site. Something bad happening at home, they have someone to talk to. Something bad happening in school, there's someone there to talk to. We catch them before they fall too hard, because if they fall hard, we'll be spending a lifetime getting them back up. This is the time you capture them. So we're going to ensure that we have support for them as well. Social media, that's another whole topic. That's another whole topic. It's one thing to get bullied and picked on, and I wasn't the coolest kid in my middle school. I came over from a Catholic grade school, and I was kind of an outlier, okay? Wasn't really friendly. It was kind of rough, but nowhere near what these kids are dealing with. Someone can be mean to your face, and you walk out and you cry, but you're not getting this constant saturation about your image. It's morning, noon, and night from social media, and so it's a whole different ballgame than we as adults had to deal with, and we need to be understanding that. Don't say, well, we are tougher than you were. Like, no, you have no idea what these kids are going through. We have no clue, and it's hard. So next month, we're convening a summit. We're going to bring together stakeholders from all over the state. We're going to focus on teenage mental health, what the answers are, and I want to be creative. Let's be creative. This is New York, my friends. People are used to looking to us for leadership. being ahead of our time, as we've been in so many movements. This is a movement to recapture the heart and soul of our people and to give them hope, those who are struggling. And those who are blessed not to be struggling, it is our responsibility to help our brothers and sisters who are. It's that simple. It's that simple. So hopefully we'll walk out of here with a renewed commitment to what we have to do as elected officials, and those of us blessed to be in government, and those of you who are running the hospitals and running the facilities, the healthcare operations and the behavioral health facilities. And God bless every one of you. You're sitting in this room because you care. You have a heart. You're sitting here because you care about other people. And I don't take that for granted. So the world we want to live in, we're defining it right now. We're defining it today. And we'll make sure that people have what they need. We'll never turn away from our most vulnerable. And we'll make sure that no one gets left behind. It's a new era for New York. We're declaring it so. We're taking on this crisis head on. And thank every one of you in this room and across the state for being part of this journey together. Thank you very much. Thank you. Thank you. Thank you. Thank you. Thank
Please welcome to the podium, Mayor Byron Brown.
Well, I was going to welcome Byron Brown too, but come on up. Byron Brown, come on down. You're the next contestant. Thank you. This is an extraordinary leader. He understands this issue like no other, and I want to thank him for helping lead the charge to bring back the mental health of all the residents of the city of Buffalo. Mayor Brown.
Thank you, Governor. Well, it's great to have our governor, Governor Kathy Hochul, back here in Buffalo and at the Delavan Grider Community Center. I would like to just recognize some of the other elected officials that are joining us. Maston District Council Member Ulysses Wingo, South District Council Member Christopher Scanlon, Erie County Legislator Howard Johnson, and I see SUNY trustee Eunice Lewin with us as well. Governor, thank you for prioritizing mental health care. Thank you for your work to make record historic investments in mental health care in the recently passed state budget. We see all across the country and here in our state more and more people dealing with mental health issues, struggling with mental health issues. Oftentimes, in communities across our state and across the country, the police officer becomes the first responder because people don't know what to do when they see people out in the community in crisis. In Buffalo, we have created a unique co-responder model where police officers respond with clinicians from Endeavor Health Services. The clinician is the lead in the response. We don't want to criminalize people who are dealing with mental health issues. Through the Buffalo Police Behavioral Health Team, we have successfully, since that entity was created, responded to thousands of mental health calls without incident, getting people in mental health crisis the treatment and the support that they need. So, Governor, we applaud you. We thank you on behalf of all New Yorkers, on behalf of our neighbors, on behalf of our friends and our family members for taking this bold and decisive action and putting these resources in the state budget so that people can get the help and the treatment that they need. Thank you very much.